wide-scale testing to be possible, both in the private and the public sector, much less expensive than the PCR tests, faster turnaround. I think it's half an hour?
Yes.
About half an hour turnaround, so no need now to send to a lab and to wait 2-3 days. And very importantly, because of the need for the private sector participation or the engagement of private sector, private labs could do it, the public health system will be able to do it, the health centers, the hospitals. So the antigen testing is a game changer for the pace and the efficiency of testing. And we're very happy for that. And I hope the country appreciates the reason why we had to wait for the right time, because we had to be guided by PAHO WHO, despite the calls and the pressures and the quarrels and the impatience and the criticisms, and despite the fact that there are so many other tests on the market. When you're dealing with people's lives, this is a sector that has to be cautious. We have to be conservative. And it's not that experiments aren't out there, trial and errors out there, margins of error, but we have to be guided by the process and be ethical in the considerations of what we sanction and what we don't. Nevertheless, we are able to do that now. We have ordered 80,000. There's going to be a requirement, which will be reflected in our orders that we put out for entities that utilize the test to report the results, positive results, or the results generally, a reporting mechanism, because the Ministry of Health needs to know what is the status of testing throughout the country, where these positive cases are and so on, because we need that for planning, for public health planning and for health planning generally. And there's going to be a requirement for some training, which we will conduct, as was outlined by Dr. Hamilton. So in weeks to come, you will see a much more broad-based approach to testing, and it will certainly alleviate some of the challenges that we have had as it relates to testing. Thank you, Dr. Hamilton. I'm sure there'll be questions later on, and we'll await those questions. I'm going to ask now the Chief Medical Officer, Dr. Bisesa Mackenzie, to quickly run through the interim guidelines for workplace protocols. This workplace protocol is in keeping with the new phase, the latest phase of COVID-19, which is the community transmission phase, which we have spoken about, which simply put means the virus is all over. We should assume that everyone has it. It is not so easily traced anymore. Focus is on how to prevent not just getting the virus, but more importantly, managing the virus in our current environment. And that includes how we adjust the workplace so work can take place while we manage the spread that will happen and is happening. So, CMO, you want to take us through that quickly?
Sure. Thank you, Minister. Good afternoon, everyone. First slide. Okay, so the Ministry of Health and Wellness has updated the recommendations for infection prevention and control in the workplace and is providing the following information to guide employers in supporting this strategy in light of community transmission of COVID-19 in the Jamaican population. The workplace is recognized as a setting in which COVID-19 can spread quickly if employees and employers do not adhere to these measures. Next slide. Just a quick overview in terms of how we have progressed in the country. We started managing actively COVID-19 in Jamaica in January when we had no cases, but we had a lot of work to do in terms of increasing awareness. March 10th, we had our first imported case, and in April, we had recognized that we had more imported cases, some local cases, what we would describe as sporadic cases, and we also had one large cluster of cases in association with the workplace cluster. In May, we had some more clusters of cases when we started to open up we had more imported cases, and then June when we had our controlled re-entry program, and then opened up on June 15th to more persons coming in, we would have seen more cases coming in and more local cases. So we would have seen an increase in clusters over that period, and then in September we would have recognized that we had several large clusters in country and that several parishes were affected. As a matter of fact, we were seeing cases all across the country that we were no longer able to link to imported cases or to other confirmed cases. So the assumption now is that there are several cases in our communities who are not known, and they are transmitting to others. So therefore, everyone must protect themselves to slow transmission and must protect the vulnerable to decrease hospitalizations and deaths. The important thing, can we just go back to the important thing to note as we move from no case to community transmission is that our methods of management have changed over time. When we had just imported cases or few sporadic cases, our aim was to contain the infection and to isolate, wall off, protect the population from the infection, separate it. When we were admitting patients to hospitals, we would wall off everybody in an isolation room, them alone in the room, because the entire population would not have been exposed, and therefore it was critical at those times to have very stringent measures in terms of the management of infection. As time went by and the number of cases would have increased and there would have been more local cases, the methods of management would have changed because the recognition was that there would have been more exposure in country. And so even in terms of our management of patients in hospitals, we would have moved from isolating everybody in individual rooms to cohorting on hospital wards, positive cases on hospital wards, the hospital staff managing patients on wards. We would have moved from pulling out infected persons outside of from their homes and putting them into quarantine facilities to managing persons within their homes, ensuring that the homes were properly assessed, but keeping those persons at home that were not symptomatic, and then moving to a position where it was that even the mildly symptomatic persons were being kept at home. Now, in the same way, next slide, please. In the same way, the management in our workplace would have changed, because in the same way when we were containing and preventing everybody from being exposed because exposure was low in the population, we would have tried to wall off and have very strict and stringent measures. Now we have reached to a situation where we are managing community transmission, and our aim moves away from containment and controlling the movement of infected persons to now living with COVID. The management of cases within the settings in which they work, in the settings in which they live, and the reduction of the exposure as best as we can, in particularly to our vulnerable populations and the persons who are likely to get more severe illnesses. Next slide. So our objectives of the protocols are to strengthen infection prevention and control during community transmission, to protect all stakeholders from infection, most importantly to ensure the sufficiency of measures for all possibilities. What employers and employees have to recognize is we no longer know who are the positive persons, because there are several positive persons in our community. They look just like you. They move around just like you. They're not having symptoms. They don't know that they're positive, and you're not going to know they're positive. It makes sense, therefore, that everything that you do in your daily operations, whether it is in your home, whether it is in your community, whether it is in your workplace, that those measures are sufficient to protect you and to protect others. And that is why we have the infection prevention and control measures. So we need to encourage continuous engagement and information sharing, protection of the vulnerable populations who operate within the workspaces. Next slide. Now, basic workplace rules are important for persons wherever it is that you work. And workers are required to wear a mask at work. And they must hand sanitize before entering their work area. Physical distancing, whether you're in an office, whether you're on a factory floor, whatever work it is that you do, physical distancing must be maintained at all work areas. Hand sanitization as you move from one work area to the next is important. It's physical distancing when you move to another location, when you go to have lunch. These are important things. Surfaces must be cleaned after use, and especially in areas where there are frequently used surfaces, these must be cleaned regularly. In this way, you can even have somebody that is positive, who don't know that they're positive, working alongside you, but they are not transmitting infection to you, they are not exposing you because they are protecting themselves, and you protect yourself as well to decrease that risk of transmission. Next slide. It is very important that management teams are engaged, fully engaged in knowing what it is that they have to do to inform their workers. Management must play an important part in advising workers about COVID-19. Workers are to be advised that if they develop a fever or they're not feeling well, then they should call in and stay home. Workplaces must make those allowances to prevent the possibility of somebody who is symptomatic coming to work. If persons are not feeling better after a few days at home, then they should seek medical advice, and that may include doing a test. If they have done a test and the test is positive, they will be required to stay at home for a minimum of 14 days, including 3 symptom-free days after symptoms are resolved. Now, because whatever workplace they are coming from has been observing all the workplace protocols, and that person would have been in a mask at work, would have been hand sanitizing as they move from area to area, then there is no need to close your business or to send home other workers. If someone in the workplace is observed to be ill and to have a fever or respiratory symptoms, then that person should be given a mask immediately, and that person should be sent home. Now, the area in which the person was should be wiped with a mild bleach solution, and the surfaces wiped with disinfectant or alcohol. Now, once this is done and the area is dry, then that area is safe to be used. Remember that the virus is easily killed by the appropriate agents. It is cleaned by using soap and water to wash your hands and to clean surfaces. It is killed by using disinfectant. It is killed by using mild bleach solution and by using alcohol to clean. Now, persons who are in contact with a person who was symptomatic, showing symptoms, then those persons, if they have been adhering to their IPC measures, their infection prevention and control measures, then there is no need for those persons to go home. They are allowed to come to work. However, they must obey the instructions and the advice that have been offered from the workplace to say that they must adhere to all infection prevention and control measures. And if they start to feel ill, they must stay home and report that they are ill. Next slide. The virus, again, is easily killed by the use of soap and water, alcohol, and mild bleach solution. Organizations need to put in place daily cleaning protocols that are sufficient to kill any virus particles that may remain on surfaces where droplets may fall. Frequently used surfaces may need to be cleaned at intervals during the day, depending on what is happening in terms of persons coming in, possibly being at a counter that will need to be cleaned several times during the day. Depending on what your business is, then you may find that the intervals may vary. Now, if infection and control measures are adhered to in daily operations, then there is no need to close offices and other workplaces. The cleaning regimen for infection prevention and control has been updated in the new protocols to reflect when a more rigorous routine cleaning protocol is required. Next slide. So in conclusion, I just want to say that with community transmission, it is likely that you will be at work with COVID-19 positive persons who have no symptoms and will not know that they are positive. Wearing a mask, physical distancing, hand sanitizing, and infection control measures in the workplace, such as daily cleaning and frequent wiping of frequently used surfaces, will be sufficient to prevent exposure. Workers must be encouraged to check themselves for symptoms of COVID-19 and stay home if they are ill. These measures will slow down transmission and prevent overwhelming of our hospitals. Protect the vulnerable in the population by adhering to these measures while at home or in the same space as elderly or sick persons. Most persons who have COVID-19 or who have chronic diseases that makes them vulnerable will not look sick. So it is very important that you stick to precautions all the time. Thank you.
Thank you very much, CMO, Dr. Bisesa Mackenzie. So the very simplified message around COVID-19 and community transmission is that the protocols, and there will be a few, in this instance, the workplace protocol, is intended to guide the workplace, the working environment, both the employer and employees, to adjust to the realities of COVID, that it could be anywhere and everywhere, that it is likely to be always present, at least for now. And so we must conform to a set of protocols or behavior that will prevent an infection or reduce the possibility of spread of an infection. It is basically saying in the workplace, there's no need to shut down if you practice continuous and more frequent cleaning. If persons are positive, you extract them from the environment, but work can go on and should go on. And these protocols, by the way, are influenced not just by us here at Ministry of Health and Wellness, but these are guided by international standards, and they have evolved over time as the study and the research around COVID and the virus continues. In the case of a novel virus, that is what will happen until it settles down and we find an ultimate solution, which normally is a vaccine. We have online Mr. Lloyd Distant. He's the president of the Jamaica Chamber of Commerce, an important representative of the private sector body generally. I know tomorrow, Lloyd, we are going to be having a meeting with the broader umbrella body, the PSOJ, which includes yourself. And, we wanted to just sort of engage you, at least in a cursory way, an initial way, based on the fact that the draft protocol has been distributed, and I'm sure you would have seen it, just to see what your impressions are, what may be your concerns, what are some of the issues that we may have to focus on, how can government partner more with you to strengthen the awareness, but also to give support so that businesses can in fact continue in the COVID environment, living with COVID. So welcome. And I know I've thrown a couple of balls at you. You want to choose the one that you prefer first. What's your impression of the protocol and any concerns?
So first Minister, I want to thank you, and of course the CMO, for the additional clarity that's being provided as we're now in the community spread phase. Many of us in the business community, as we saw, all of us as Jamaicans, as we saw that ramping up and increase in numbers, and as we hear the term community spread, we'd have had our own concerns about what next, what additional should we do? I mean, do the existing IPC guidelines apply? So getting this additional guidance is quite welcome. I certainly appreciate the guidance about the necessity, or rather it not being necessary to shut down operations. We've been sort of following the science or data that would justify a temporary shutdown as against doing a proper and intense deep cleaning activity. So, taking that guidance, it says if we identify if there's an employee who has turned up positive for COVID-19, seal off the area, do a deep cleaning, and then restoring it for use as being an activity, we can certainly appreciate and accept that. Again, noting that this is a guidance, so it doesn't limit businesses from taking other steps as they believe are necessary for the protection of either their employees or their customers at large. I also appreciated the pragmatism around the recommendation that we saw in the document about a higher concentration of agents for cleaning, as well as cleaning the areas more regularly. Recall a conversation with some of our members in the tourism industry saying that they're cleaning their areas every 30 minutes. And as the CMO indicated, the extent to which there are high use areas, businesses, employers certainly need to, and management need to make that judgment call about ensuring that those areas are being cleansed more regularly. So certainly take that on. I certainly anticipate the business community will appreciate and accept the, I use the term, the prudent guidance that's being given in terms of the intensity of sanitation. And again, for members of the business community who are listening to this, we will certainly reiterate that there's nothing here that limits you from taking that extra step for fogging and disinfecting as necessary, but it's primarily to ensure that the areas are being cleansed more regularly.
Thank you very much, Lloyd. I wanted to ask you a quick one.
One other comment, Minister.
Go ahead.
Minister?
Go ahead.
Yeah,
go ahead.
Okay. So, and I leave on 2 points very quickly. One is in terms of the other employees who have been in direct contact. So that's an area I believe that we are not 100% comfortable with. Again, it's left up to employers to make that decision, but certainly believe that, especially in those businesses that are concerned around clustering, they may want to make that decision about releasing those employees who are in direct contact with someone until we have a test or we are sure that they're not symptomatic. And the final point is in relation to the testing. Certainly want to express our appreciation. We've been looking for the additional ability to test, and certainly this opportunity will be provided for those employers who want to arrange their own testing for staff under a broader set of parameters.
Okay, don't go yet, Lloyd. The CMO wanted to make a point. I'm not sure if it's a question or just a comment.
Yes, it's a comment, Minister, Mr. Distant. So certainly your measures are going to be a lot dependent on the level of comfort that you are going to have that the infection prevention control measures are being adhered to within your workplace. So if it is that you're allowing persons to come into your building who are not wearing a mask, and if you're not insisting on physical distancing, then more certainly you're going to be at a higher risk of exposure of the persons that are already in the building. So as time goes by, it must be that the adherence to these measures, which is what is going to be sufficient for you to be confident that there is very limited exposure. There is also a recognition that persons need to have that with community transmission, your possibility of exposure is at several points. In your home, within your community, in transportation, at your workplace. They're all, the possibilities are all there. It's no longer that I know that there's a positive patient living on Y Street, so I'm not going to go on Y Street. It's no longer that. It's that we have persons that are positive, that are across the country, within our communities, within our workplace. We have to recognize that we are more than likely working with somebody who has COVID. There is a high possibility that there's somebody with COVID in this room, but we're maintaining physical distancing and we're wearing our mask. And that is, and that needs to be sufficient on a day-to-day basis for that would allow us to be able to come here and to do these presentations and to carry out the work that we have to do in this emergency operations center. That's the reality. We have to recognize that. The important thing that I also want persons to recognize is that the virus lives inside a person. It requires being in a living human being in order to survive. And so therefore, the extent of it staying alive on surfaces for long periods that are going into days. You know, I mean, I see people close down over the weekend and come on Monday and deep clean. I mean, 48 hours have passed, you know, it's very unlikely that any virus is going to be surviving, you know, and if you're doing your regular routine cleaning, it is sufficient to kill the virus. So, you know, those are just some points I just want to make.
Thank you very much, CMO. And Lloyd, I'm going to give you a chance to respond, but just to add as a parting sort of question for your comment. But first of all, what the CMO is echoing is that because the virus is everywhere, trying to say that we are avoiding by shutting down is not as logical as it used to be when the virus was only in some places. And I know it's difficult because we have been accustomed to saying to the populace, do this, do that. Now we're saying, change the approach. And it is going to take some getting used to and some communicating across the board and actually some faith on the part of those who are listening to accept that what is being said is driven by the science, driven by the research, driven by a studied opinion and by the experts. And finally, it's going to require significant personal, individual responsibility. The community transmission phase is a phase that requires an all-of-society approach more than any other phase. Everyone has to play their part. That's why we say everyone counts. And in the context of a work environment, every employee, employer, their workspace has to comply with the rules of engagement, assuming that if the virus is present, it is confined to that individual and not going to be spreading across the board. And if we take that approach, then we will make it happen. So my question to you is, as president of the chamber, I mean, we need to determine how we can work together. And I know this conversation will continue tomorrow. But you have a burden as the president. Presidents carry burden, right? Leaders. And the question is, how do you get that across generally to your members and to commerce generally? Because it's going to require your input and involvement and engagement in terms of what needs to be done. And I ask you to comment on that, and then we can move on to other questions from others.
So Minister, certainly from where the chamber sits, and I would have spoken to my colleague leaders in a number of other business support organizations, we are of the view that we have a responsibility to ensure that our membership, as broadly as possible, are aware not only of the protocols, but of either the science or the pragmatism that goes behind them. The point that the CMO opened with and the point that you closed with in relation to that personal responsibility. We've continued to hammer that out. Our communication, certainly in the meeting that we have scheduled for tomorrow and beyond, both directly in our board meetings, exec meetings next week, and communication to our members and the broader business community, is about that responsibility that we have. Responsibility as business leaders, responsibility as employers, and responsibility to the customers who come into our business places to ensure that we are taking the necessary steps to encourage and go beyond encourage, to enforce the extent that we can, that the people within our environments are following the protocols. So certainly that commitment is there, Minister, and we'll continue to hammer it through together.
Thank you very much, Lloyd. Appreciate it. And thank you for joining us and for articulating an appreciation for why the protocols are necessary. We'll pick up the conversation tomorrow in private with the rest of your team members, and I'll be available, whether here in the corporate area or elsewhere, to encourage and to be a part of the solution, because we have to work together. Thank you very much. Thanks for joining us.
Thank you, Minister. Thank you, CMO. Clarity was good.
I want to just say that in terms of tourism, this is an important point I want to make, that last night myself and the Minister of Tourism had a long meeting, and today we had our regular cabinet subcommittee on COVID chaired by the Honorable Prime Minister, and that too was a long meeting with the public health team and a number of other ministers. A range of issues were discussed in regards to the current orders and the adjustment, given that they are now coming to their expiration date. The orders, of course, are the rules that have been applied to trying to control COVID, curfew hours and all the other critical issues. I want to just say that more will be said on that, because these recommendations will go to Cabinet on Monday, and at that point the public announcements made. But I've been given the permission to say that from a tourism perspective, we are reviewing the pre-testing approach that is now in effect, primarily coming out of North America, but from other countries, where a tourist who visits the Visit Jamaica site would need to upload a PCR pre-test. And that PCR pre-test, of course, would have to be negative, which would allow that person to travel to Jamaica to visit. We are reviewing, meaning public health, with the sanctioning of the cabinet subcommittee and the Prime Minister, the reasons why the pre-testing was put in place in the first place, which was based on the risk assessment in the markets where most of the tourists were coming from, or visitors were coming from. When it was introduced initially in 4 states, then extended across North America, it was based on the significant increases in positivity rates in that jurisdiction, or those jurisdictions if you consider them as states. Today we're seeing adjustments in that risk profile, where a number of states are seeing a decline in positives, and in some instances a significant decline. And the inclination, therefore, based on that assessment, is to review and determine to what extent there is a need for the pre-testing, either across the board or in selected states. And the public health position will be recommended to the cabinet, and a decision will be taken. And we're looking to have a decision taken certainly by the end of this month, for the 1st of October, if possible. And it could possibly mean that we would do away with pre-testing, if not altogether, certainly in regards to certain states. That should address some of the challenges that we have been experiencing as it relates to our visitors coming in. But more will be said on that, but I wanted to just place that on the table for those who may be concerned. All right, so thank you very much for that, and we are now ready for questions. Stephen?
Thank you very much, Minister. Just inviting our media colleagues to use the raise hand feature on Zoom if you have questions for any member of the team. We're going to begin with Brittany Clark. Brittany? Unmute her. All right, we're going to come back to you, Brittany. Let's go to Althea Saunders. Althea, just introduce yourself, please.
Jamaica Observer. I just wanted to know if the Ministry of Health has been able to make any connection between the record high numbers we're seeing for the last 24-hour period to the election campaign activities.
So when we look at the positive that we had, the range of onset of these symptoms were earlier in September. We are keeping a close eye on the reproductive rate, and around that time, it was at this time above 1, approaching 2. So we can't definitively link it at this time. We need a little bit more time. We need at least 2 weeks to say what happened and the transmission around that time. Thank you.
Thank you very much. We're going to go to Jamaica Social.
Good evening, folks. I'm Cassius Watson for Jamaica Social. I have 3 questions. One is regarding the PCR and the antigen test. Are you officially saying that they'll run side by side with each other, or one will replace the other? I need a definitive word on that. The second has to do with, goes to the minister regarding the messaging. It's clear from the numbers that we see you report every morning that a number of people in their 70s and 80s are infected with COVID-19. Clearly, their initial message about protecting the elderly is not working. What else do you plan to do, or what else is in the pipeline regarding that type of message? And thirdly, and this goes to the CMO, I guess could chime in on as well as the minister. Regarding your relationship, we know of Jamaica's relationship with China regarding construction and other infrastructure. What role is China playing right now regarding COVID-19 and Jamaica, seeing that they are, the virus is literally behind them, people are not necessarily wearing masks or being forced, and they're getting back to normal life for the most part. Have they been teaching us anything? Has there been any close relationship regarding discussing the way forward for Jamaica using China as an example? Thank you.
You want to go first?
Yes, I'm happy you asked this question, because we need to make it very clear. We are not replacing the PCR test. What we are doing is supplementing it with the antigen test. The PCR test remains the gold standard, the most reliable test on the market. What we are saying is that at this time, antigen tests have been approved, and these antigen tests are not as reliable in all circumstances as the PCR test. However, they are able, especially given the stage of community transmission, to detect the positive cases. If you test asymptomatic persons, they are not as reliable, and approximately 20% of the persons who have COVID-19 may not give you a positive result. So we will be utilizing the PCR test along with the antigen test to check those persons who give us a negative antigen test but are symptomatic. So what we are saying is that we are introducing the antigen test at this time to help to broaden the base for testing and to help to reduce the turnaround time which test results are available. But we still need the gold standard test, the PCR test there. However, with the antigen test, we will have to do much less of the PCR test than we are currently doing now.
Okay, so the antigen test is going to make things more efficient because you can apply that across the board, many more distribution points or application points, quicker turnaround of time, half an hour or so, less cost in the case of private sector charging. Of course, the public health system would not charge. And, where there may be doubts, then clearly one can do the PCR test, which will take a little more time, but will give a more accurate outcome. But the antigen test can also be applied in the case of particular industries or for particular purposes, so the tourism industry. So it offers a world of different possibilities, and that is a positive thing for living with COVID. In other words, for ensuring a quicker turnaround to restore normality in a case where you're concerned. As it relates to the question of the 70 plus, there are some restrictions, as you know, in terms of movement beyond a certain age. But I would not be as extreme to say that the communication is not working, because the truth is far more persons are adhering to the communications pitch than those that are not. And the death rates, as regretful as that is, are still, when compared to those who are existing, surviving, and not getting COVID, is a very small percentage of the overall population of that segment. So one death is one too many, and we regret that. Can we improve? Yes, and we will. We will be looking at other ways to communicate and to communicate more efficiently and to vulnerable communities like those over a certain age. So expect more, but I would not be prepared to argue in the extreme that the communication strategy is not working. On the issue of China, we have worked with our bilateral partners across the board, and China is a good bilateral partner, and we have had dialogue. They have provided some assistance in terms of PPEs and some equipment, discussions also around some of the experiences, and that dialogue continues. And this is the approach that we have taken from the start as it relates to both the multilateral and bilateral partners. And we think it has benefited us, and we will continue to do so. So China is certainly one of several who have been a critical part of the process of finding solutions and going forward.
Thank you very much, Minister. We're going to go back to Brittany Clark.
Okay, good evening again. Are you hearing me better now?
Yes, go ahead, please.
Okay, great. All right, so I have two questions. The first, well, both are around testing, but the first one, is it possible for the ministry to explain the extensive waiting period for persons to receive their test results, to include essential workers? And, is it as a result of a backlog? And if there's no backlog, how exactly does the system of prioritization work when it comes to returning test results? And the second question is, given that private facilities are offering COVID-19 testing, are those positive patients which would have been tested in those private facilities, are those patients accounted for in the daily Ministry of Health update? Thank you.
Yes, so unfortunately, yes, we are still facing a backlog. And, it's a daily challenge for us to try to bring our testing up to date. And, we have discussed the challenges that we face in terms of availability of the reagents on a consistent basis. So I know that many persons are concerned. They see the testing at 300, 400, some days 500, some days, and then they see a spike, 700, 800, 900 tests. Whenever we see those spikes, that means that we have gotten a supply of test kits. And so we try to test as many as possible to try to get down the backlog that we would have had based on the days when we don't get adequate supplies. So we have two sets of testing going on. Testing on the open PCR machine, where we are supplied with reagents through PAHO WHO and through some procurements on our own. And that continues, and on a regular basis the test amount ranges from between 300 to 500 tests on those machines. When we have the COBAS machine working at the same time, we will get about the same amount of tests on the COBAS itself, so we will double the numbers of test results that we see. So on a weekly basis now, we are getting reliably between 5 to 10 test kits coming in from the supplier for the COBAS machine. And so I'm sure the astute persons would have noticed that maybe once or twice for the week or 3 days for the week, you will see our numbers go up. So this is what is happening, and it's important for the public to understand that. This does result in a backlog of cases. We do try to prioritize our healthcare workers to try to keep our wards clear, to be able to manage our patients. That's our real priorities at this time. And so we try to prioritize these as soon as we hear about the cases, healthcare workers being affected, or we have cases in hospitals that are waiting on results, especially when we're managing our severe acute respiratory patients or critically ill patients. We try to prioritize those and get those done quickly. Now, the antigen test is going to help us where this is concerned, because we are going to be deploying the antigen test, first of all, to our regional hospitals, where it is that the symptomatic cases, so our doctors and our healthcare workers there will be able to get back their results within hours of doing the test, because the test itself takes about half an hour, and they will still have to collect the samples and send it to their lab, and they will be able to get a turnaround in the same day. So they will be better able to keep up with clearing the wards and suitably isolating or quarantine patients. So yes, we do face challenges. We try to respond to them on a daily basis. We have strengthened our emergency operations center in getting reports in from the hospitals on a daily basis so that we can manage these incidents effectively and be very responsive to the situation on the ground.
If I may, I'm going to play journalist and ask Dr. Hamilton a question. You speak about the accuracy of the tests, the antigen tests. Can you just explain a little in terms of what the margins of error would be based on the symptomatic versus asymptomatic? Because I think that would help.
The test is recommended, it's approved for symptomatic patients. And we have found that with symptomatic patients, the level of reliability of the test results increases. We expect, and results have shown, that 100% of the symptomatic cases usually are positive for COVID if the symptoms are in fact due to COVID-19. However, with the asymptomatic patients, with the particular kits that we are using, we are able to miss at times up to 20% of those who are really positive for COVID. So we'll detect 80% approximately of those asymptomatic patients who are COVID positive. We will detect those, but we will miss the remaining 20%. And so for those patients, we would have to follow up with the PCR test. But I want to make it very clear too that we are putting on the market tests that have been approved by PAHO. There are antigen tests out there with a range of sensitivity. And so the one we are using can give us approximately 80% sensitivity. We pick up 80% of the cases. But there are other kits out there that are antigen kits that will pick up much less. And that is why we are asking you to use the kits that have been tested and recommended by PAHO instead of thinking that, well, antigen tests are in now, so we can just take any antigen test, because the range of accuracy varies. And we are concentrating on the test kits that give us the most accurate results, the antigen test kits.
So what I would say, Dr. Hamilton, and to the listening public, is that the antigen tests would serve significant benefit to those who may feel they have symptoms, particularly in the season of the flu, and require a test with those symptoms to determine whether it's COVID or the flu. I'm giving an example. And it would easily rule out those persons who may have symptoms, but it's not COVID, because the results turn up more so when you are symptomatic. Is that what you're saying? If it's COVID and you're symptomatic, then the results are showing 100% accuracy, or you'd say as close to that as possible. It's when you're not symptomatic, you may feel that you have come in contact with someone, but you have no symptoms. It will pick you up to 80% of the time. Is that what you're saying?
What we are saying is that, especially now, part of the accuracy of the test is going to be dependent upon how many persons actually have the COVID-19. And so the accuracy will depend upon the number of persons who are symptomatic and have COVID-19. Now, one of the reasons why we do validation tests and we monitor very carefully and we use our PCR tests to confirm or to double check our results is that we want to find out in our local setting how this kit performs. Yes, if you are symptomatic, we know that from other studies, we should pick you up if you have been positive for COVID-19. But then understand that if you are symptomatic and you are negative, we still want to make sure that this is not now a new phenomenon, that we are missing some positive cases. We want to be sure that you don't have COVID-19. So we'll still be investigating. We expect you to be positive if you have COVID-19. But while we are using the test in Jamaica for the first time, we are going to be doing PCR to check some of the positives, some of the negatives, just to ensure that what we are getting is going to give us the most reliable results. So one of the things we want you to understand, this is why we need the private labs to work very closely with us, because it's not just a test, but especially in the early stages, the interpretation of the test is going to be key.
Thank you.
Thanks very much, Dr. Hamilton. I'm going to go to Debbie Ann Wright.
Good evening. I know that the ministry sends out information regarding recoveries, but have we had any patient who is considered critically ill or who have had to be placed on ventilators recover?
For us,
the question is whether anyone placed on a ventilator has recovered. This is a COVID patient, you mean?
Or anyone who is critically ill.
Anyone critically ill?
Right, any COVID.
Okay, let me ask the clinicians to respond to that.
Yes, we have had critically ill persons that have recovered, and I must say that I think in our next press conference, Minister, we will speak a little bit more on this in terms of giving the details, because we have identified at the ministry that this is a question that the public is interested in. So we're gathering the data on our moderately ill and critically ill persons, and I think that we will commit to doing a presentation on this in our next press conference. But yes, persons that have been critically ill have recovered, and persons that have been on ventilators have recovered.
Thank you. Stephen?
Thanks. We're going to have two follow-up questions, one from Jamaica Social and one from Brittany. So go to Jamaica Social quickly.
One quick question regarding discharge testing. This is to the CMO. I recall, I believe last press conference or the one before, you said that you are moving away from doing discharge testing because at some point in the recovery, I mean, what you see are just literally fragments or remains of the virus, and it doesn't really tell the true picture about recovery. As normal, as far as you're concerned, after 10 to 14 days, that person, as the gold standard is, should be recovered for the most part. I noticed that in the report that comes out, I'm still seeing some small numbers of discharge testing. Is it that you are getting to a point when you're going to be going full everybody after 14 days, or you're still going to be doing discharge testing? Or at what point do you stop doing discharge testing? Thanks.
We have in fact, from a policy guideline that have been sent out from the ministry, changed our protocols, and so we do not do discharge testing except for the critically ill persons who would have been critically ill in hospital. Then we would do discharge testing on those persons. So there's a small subset of persons that we do some discharge testing on. However, I do believe that some of the cases that you're actually seeing being recorded, we may have persons in the field that are still doing some discharge testing, but that is not the protocol for the Ministry of Health and Wellness at this time. We have moved away from that for some time now, in keeping with the guidelines from the World Health Organization. But the critically ill persons, you will see discharge testing for those persons.
Thank you very much. And that's the final one from Brittany.
Okay, just a follow. Well, my second question wasn't answered earlier. It was, are patients who do COVID-19 tests with private facilities accounted for in the ministry's daily update? And my other question was, has there been any discussion or progress made with insurance companies to assist COVID-19 patients? Thank you.
In terms of our guidelines for private laboratories that have been put out for persons who would want to do private testing, a part of the guideline is that they are required to report. Now, no, we have not so far have any private lab that have been approved by the Ministry of Health. We are aware that persons are doing testing using other certifications that they would have from other organizations. But as an approved Ministry of Health and Wellness center, we have not had any approvals completed. Some persons are still in process of doing that. But a part of the guideline, and I would encourage all laboratories, whether or if you are doing testing, then you really need to report. And we will be making steps over the next 2 weeks to put in the measures to ensure that there is compliance, some measure of compliance. We recognize that we have not been getting the required reports from some laboratories, and we would be putting in measures over the next 2 weeks. So laboratories need to look out for this, because they may not be in the right if they are doing testing and they are not reporting.
Thank you very much, CMO. We'll just go to Minister to bring his closing remarks.
All right, thank you very much. Well, in response to that question about insurance and progress, Brittany, I know the Ministry of Tourism, the Minister of Tourism and his team are looking at an insurance policy around visitors coming in, and they are close, based on what I've heard from them and from him, to an option that persons visiting the island can exercise that would allow a number of benefits, including airlifting back to their country of origin. I'll allow him to speak more on that, but it is in the making, to put it sort of simplistically. I can't say about insurance companies generally in the population and the locals, because I really don't know, to be totally frank. I would have to check on that to see. Of course, the best insurance you have at this point is to go to a public health institution, whether a hospital or health center, and that is already paid for. And we work hard each day to give as much support, and we get about 3 million visits a year to both health centers and hospitals, and I think the team does a good job. So that option is always there. So in closing, ladies and gentlemen, I want to thank you for staying with us this evening in our COVID conversations. We, as promised, tried to offer a slight variation from what normally is the case. Did not spend much time on announcing the numbers. You can visit the Ministry of Health's website to get the numbers. We did commit, and we have tried to live true to that. At 10 a.m. each day, the numbers are uploaded, so you get the last 24 hours numbers, deaths, hospitalization, positive cases, tests, and all the information that used to be distributed. I do take note that we have had some feedback on social media, persons asking for the updates in the traditional form. I've been on the receiving end of some of the criticisms for not giving the regular precursor to the numbers and then the numbers. I fully appreciate and understand why persons would want it that way, and we will discuss it and we will look at it internally. But I want persons to also appreciate why we chose to go the other way. I mean, there were some who criticized the uploading from my pages, for example. Others have now said it should continue. So, you get mixed views. I do appreciate those who have encouraged the continuation, and I thank them for that kind of encouragement. However, one, we really want to shift the focus in this phase of the pandemic, where we are now having community transmission, less on positive cases, which are important. We really are trying to make or minimize the positive cases. But in this phase, we're going to get a lot more. And it's important that Jamaicans understand that, because it's everywhere. And we have to go through that phase. And we did say over the next 2 to 3 months, we're going to see that. If we focus solely on that, or primarily on that, we run the risks of not focusing on the measures that are important, the individual responsibility that is critical to living with COVID and overcoming COVID. So it's really about what are the precautions we need to take, what are the new protocols that we need to adhere to and practice, how do we access the hospital system, how do we protect the vulnerable, how do we operate in the workspace. Those for us represents currently the most important elements of the COVID response. And what I would like to do in the months to come is to update, whether from my pages or from the ministry's pages or anyone else, the information around coping with, living with, and overcoming COVID. That to my mind is the encouragement that the population needs, the leadership it needs. And it's not that we're hiding the numbers of positives, but frankly speaking, the overwhelming majority of positives are going to recover. We have to help persons to avoid it or recover from it, while we give critical support to those who are most vulnerable. So while we will review constantly and update and adjust as necessary, I just want to say why that decision was taken. Thank you very much for joining us today. We had a good discussion, I think. The antigen test is now here. You want to say something? The antigen test is now here. I know it's long overdue. We've asked, well, it's coming. So we have announced in the weeks to come. We're doing some preliminary work now. It will be available across the country once you subscribe to the protocol involved, the training, but also the reporting mechanism. And we will lead that charge. The workplace protocol will be out soon. A draft has been circulated. I intend to be out in the field to visit with employers, employees, to help to push the agenda of the workplace protocol and individual responsibility. The tourism interests will likely see some relief as it relates to pre-testing. That is being assessed, but it looks encouraging. But again, that's not my decision solely. It's a decision by the cabinet, influenced by the advice. And of course, finally, but of course not in any way less of the important information today, I want to welcome the minister, our new minister, Minister Cuthbert Flynn, for joining us and for being a part of the team. Thank you very much, and we will continue the conversations in the days to come. Please help us with that conversation by encouraging others to subscribe to the protocols that we are promoting. Thank you. God bless.